There's new data out that reveals that Americans trust the scientists working at federal health organizations more than they do the Trump-appointed leaders of those agencies, some of whom who work in that White House. The new survey conducted by the University of Pennsylvania shows that 67% have confidence in scientists working at agencies like the Centers for Disease Control and Prevention, as well as the Food and Drug Administration. But only about 4 in 10 Americans say they have confidence in Health and Human Services Secretary Robert F. Kennedy Jr. and the administrator of the Centers for Medicare and Medicaid Services, Dr. Mehmet Oz. Let's now bring in MS Now medical analyst, Dr. Vin Gupta, who we trust implicitly. Dr. Gupta, good to see you. This is a startling split, right? Where it's saying Americans seemingly still trust the professionals, the bureaucrats, the doctors who work at these institutions, but not so much those appointed by President Trump.
Yeah, Jonathan, good morning. Not surprising, given the cadence and the drumbeat that we've seen, you and I have talked about for the last year now. This is having real effects in what is a representative, over 1,500 adults across the country sampled in what is a representative survey on their sentiments on what they're hearing, what they're seeing from RFK Jr. and his main deputies, and they don't like it. The majority, the vast majority, do not have confidence. This is what the survey found, what you teed up, in what he's saying or what Mehmet Oz is saying to the public. But 86% have some degree of confidence, either somewhat confident or very confident, in what their own personal doctor is telling them on their medical, on any medical issue, or what the American Heart Association, these medical societies that are trying to fill the void here with rational, apolitical, calm health information. They are filling the breach, and Americans are seeing that. And again, this is across the political divide. This is not speaking to one side of the aisle. So I think that's reassuring. One, that people want normalcy. Two, they don't want chaos. And we're seeing this in the numbers.
Molly, I guess it's not surprising that someone like Robert F. Kennedy Jr. would not be trusted by the American people when he is, for instance, such a vaccine skeptic. At the same time, we're seeing these measles outbreaks in various parts of the country.
Yeah, for sure. And he has now decided to sort of focus on nutrition, and he is getting schools and medical schools to focus on nutrition education. Can you talk us through how what that looks like?
Yeah, Molly, this is, I think, important to keep in mind that they are very good at marketing and at salesmanship. And so what's happening here? No one's against nutrition and better nutrition education in medical school. And that's really what they're saying. Hey, we're going to increase the number of hours aspiring doctors are exposed to nutrition education from about 20, where it is roughly right now, to 40 hours across their curriculum, 3 to 4 year curriculum. Great. Okay. Is the content of that policy that they announced in Austin just this week, is that actually signaling intent? Is that going to help patients ultimately eat better health outcomes? And that's where this is more complicated than them just saying, hey, we're going to do this and we're going to strong arm medical schools through the threat of funding if they don't do this. Again, they're good at the salesmanship, but what about the policy? What we know is that supplements, for example, are not studied, Molly. We have no idea as allopathic physicians. How should we be thinking about guiding our patients on supplements? More people take supplements than they take prescription medications. There's no studies. Did RFK say anything about FDA regulation of supplements? No, he did not. Did they talk about SNAP and the catastrophic cuts to SNAP that allow people, vulnerable people who eat fast food, who have no other choice, to actually access fresh foods and vegetables? It's one thing to say, hey, a doc's going to talk to you for 60 seconds more about nutrition in your 15-minute visit. But what about the economics of healthier eating? They don't talk about that. They also don't talk about the fact that health insurance only, Molly, covers nutrition counseling through registered dietitians, who are the real experts here, for those who have an underlying chronic condition already, like diabetes or high blood pressure, not for the general public. So there's insurance issues when it comes to accessing nutrition counseling, real expertise. We're not giving people who need access to fresh veggies the ability to do so from an economic standpoint. And what about supplements and regulation there and actual meaningful studies? So good salesmanship. The actual policy here, I think, is different from the intent.
Right.
MS Now medical analyst Dr. Vin Gupta. Dr. Gupta, thank you as always.